So when it comes to lumbar erectors, certainly if you're seeing myself on the chiro side of the hallway here, you're going to get rehab exercises. Specifically, we're going to start with McKenzie Method to see what's the best exercise for improving your pain, your function, your movement, and cutting down your muscle tension. And then one of my favorites, and we're going to demo this on a technique video, is I love using my elbows to do a long elongation of those muscles and just kind of also sweep through and break up the adhesions that live in the myofascial layer. And then that also kind of serves as a nice little stretch. My favorite tool for hitting the lumbar erectors, the QLs though, flexion-distraction table. So using the table to drop down at the hips and pull open the back and really just work on so much blood flow, neurological reset, and muscle tension reduction into all those muscles. And then, of course, as a chiropractor, I love to adjust. Not everybody's a good candidate to be adjusted, though. So that's kind of what I always say. If we have to pick something else, so be it. Whether that's the person's in too much pain, they're apprehensive about being adjusted, they've had bad responses in the past, and they say, hey, can we try something different? You and I think, are both pretty good. I guess not that I'm trying to pat ourselves on the back too much, but we're both pretty good about slowing down, listening to what the patient says they feel like they need, and course correcting accordingly, right?
Right.
So what are some of your favorite techniques to get after like the erectors and the QL and whatnot?
Yeah, so use some nice muscle stripping is one of the techniques. Um, in general, um, when I'm treating that area, I like to start out broadly and see how everything functions as a whole, like fascially in that region um, to see where there might be restrictions, particularly in that superficial layer, and then from there you can go deeper and or more specific to work out each individual muscle in that region. And yeah, so yes, I mean the sometimes the slower the better,
Yeah,
right?
yeah.
Sometimes you'll need to stay in an area for a while to let it um, release.
Yeah, melt is
Um,
the word I was thinking
mhm.
of, but yeah.
Yeah, yeah. So once it um, yeah, so once it melts, then kind of retest. And when I say retest, that means I'm palpating. I'm not really typically asking the client to do
Right, right.
anything, but kind of then go back to the um, broader palpation tools to see what's
Yeah,
going on. So
yeah. And then in my experience too, I
mhm,
think you like also utilizing some dynamic movement too,
mhm,
right? Like you like to try to use
mhm,
the hips as levers to
mhm,
create some better
mhm,
stretch and better release
mhm,
into the low back as well too,
mhm.
correct?
Yeah, just use. I like to use what I have
Yep.
available to me. So I like using um, the client's body weight as pressure whenever I can, so that so that way it's kind of their body's helping them as well
Yeah.
along the way. So but yeah, I mean there's yeah many different massage techniques that can be used for that for that region. And
Yeah.
um yeah.
And just a reminder
hmm
to all the people that have stumbled upon our channel and or already
hmm
subscribed, right? That the
hmm
technique videos are going to come. So
hmm
some of the stuff that Ben and I were just describing, I know it could be hard to
hmm
visualize because we're talking through it. You and I could see it
hmm
in our heads. I know not everybody else can, but definitely stay tuned for the videos.
hmm
Maybe hit a subscription so that way you can see when those videos drop.